Hello, and welcome to today's webinar, Behind the Screen, Understanding and Addressing the Behavioral Health Impacts of Tech-Facilitated Abuse on Adults. Let's meet today's moderator and introduce our panelists. So Katherine Chon. Katherine Chon will serve as our moderator of today's panel. Katherine is the director of the Office on Trafficking of Persons, or OTIP, at the U.S. Department of Health and Human Services. Our panelists for today, we've got Adam Dodge, Jacob Berger, Kate Keisel, and Dr. Morgan Pettyjohn. I'm going to introduce each of them. So let's start with Adam. Adam Dodge is a digital safety advocate, an attorney who believes you do not have to be a tech expert to protect yourself or others in the digital age. He has trained hundreds of organizations to address tech-facilitated abuse and improve safety and well-being of people online. Thank you, Adam. Next up is Jacob. Jacob Berger serves as a lived experience consultant for federal organizations and NGOs, specifically related to developing and improving programs, legislation, and marketing campaigns related to technology-facilitated abuse. He uses his experience as a touring singer, songwriter, and performer to increase awareness on TFA. Thank you, Jacob. And next up is Kate Keisel. Kate's work is dedicated to advancing healing, wellness, and systemic change for individuals and communities impacted by interpersonal violence. She currently oversees Project Lighthouse, a national initiative funded by the Office for Victims of Crime that provides mental health and wellness services to survivors while strengthening trauma-conscious system responses to technology-facilitated harm. Thank you, Kate. We've got Dr. Morgan Pettyjohn. Dr. Pettyjohn is an assistant professor and researcher focused on the intersections of digital technologies with survivor experiences of victimization and help seeking. Dr. Pettyjohn's work includes oversight of a project to identify and respond to tactics of TFA through partnerships with local victim service providers. Thank you, Dr. Pettyjohn. Now I'll turn it over to Katherine Chon to get us started.
All right. Thank you, Samantha, and to our colleagues at the National Human Trafficking Training Technical Assistance Center for bringing together such a great panel of experts for today's session together. Hello to everyone out there. Thank you for taking the time to join us today. As we've all experienced, digital technology is evolving rapidly. It's increasingly embedded in our daily functioning, our relationships, even in our access to care. Technology is helping us to stay connected and work in different ways, learn in different ways. But as technology evolves, so are the ways that people are using technology to harm, control, and exploit others. Technology-facilitated abuse is a serious and growing public health concern that intersects with many other forms of violence, whether it's interpersonal violence, including human trafficking, child abuse, intimate partner violence, and sexual abuse. For behavioral health settings, it has very direct implications for engagement, safety planning, risk assessment, and continuity of care. One of the reasons we wanted to bring together these experts today is because we've been monitoring recent data that's been underscoring how widespread the abuse of technology has been in terms of inflicting harm on others. For example, in one report, about 70% of young adults in the United States have reported experiencing some form of technology-facilitated abuse. About 7.5 million people experience cyberstalking every year, with 80% of those victims being tracked through some form of technology. And sextortion affects somewhere between 4% to nearly 19% of adults, depending on the study that you're looking at. This webinar is a follow-up to a webinar that we held specifically for behavioral health providers when it comes to tech-facilitated abuse among children and youth. This webinar focuses more so on what clinical care settings could look like for adult survivors of tech-facilitated abuse. One of the things that makes this issue so challenging is that through technology, there are many ways perpetrators can access, target, harm, or exert control over someone, often quietly, often undetected. In clinical contexts, that invisible quality can intensify fear, shame, isolation, hypervigilance, and can complicate help-seeking behavior. Most of us rely on technology every day, whether it's smartphones, laptops, smartwatches, social media, payment apps, location services, and now increasingly there are multiple tools that are out there powered by artificial intelligence. And while these tools can be helpful, they can also open the door to surveillance, coercion, harassment, and exploitation, sometimes in ways people don't fully understand until it's already happening. For many clients in behavioral health settings, the concern isn't only what happened in the past, but what may still be happening in real time. Our goal today is to better understand the issue, its impacts, and what it means for our work. We'll focus on how technology-facilitated abuse presents clinically, what to listen for in an assessment, and how to integrate practical trauma-informed responses and safety considerations. Ultimately, we want people who have experienced this kind of harm to also experience increased safety and agency, and we want providers and systems to feel better equipped to help and support. With that, thank you again for joining us today. Now let's turn to our panelists. Okay, I'm going to start, Morgan, with you on if you can just give an example of what are some forms of technology facilitated abuse that behavioral health providers should be aware of?
Yeah, thank you, Director Chon. So technology facilitated abuse, or TFA for short, is an umbrella term that encompasses a wide range of abusive experiences that are facilitated through online spaces like social media or networking platforms, and through the misuse of everyday technologies, so phones, emails, home security systems, things like that. TFA is diverse in both presentation and the tactics that are used. However, all forms of TFA can compromise an individual's privacy and cause emotional, physical, or social harm. And it's important to recognize that TFA can happen across any type of relationship. So intimate partners, neighbors, family, even strangers on the internet, and it can happen at any point across the lifespan. It has a harmful impact on both youth and adults, but as Director Chon said, we'll be focusing today on the adult population. So on this slide, I present some common forms of TFA that you may see in practice. So coercive control refers to patterns of behaviors that are used to take away someone's freedom and to control their life. These behaviors are typically perpetrated by an intimate partner or in situations of trafficking. And because digital technologies have become so integrated into all aspects of our lives, from our jobs to our banking and shopping to our ability to communicate and socialize with other people, they have also become extremely powerful tools for control. So TFA within dynamics of coercive control may include things like surveilling a victim's behaviors or their movements, controlling their finances, or isolating them from their support systems. So a common example that we see in community-based violence agencies is abusive partners accessing victims' email accounts, which often then helps them also gain access to all of their social media, their banking, things like that. And once they have infiltrated all of these accounts, they're able to do things like monitor who the survivor is speaking to and what they're talking about. They can block emails or accounts that interfere with the survivor's personal and professional relationships. And they can cut off or sabotage their finances, making it increasingly difficult for the victim to exit the relationship. Technology has also made it increasingly easy to harass and stalk people. So between calls, texts, emails, social media, there are seemingly endless ways to make repeated unwanted contact with another person. And unfortunately, just blocking numbers or accounts is often ineffective because of how easy platforms make it to create new usernames, and the creation of apps that specifically allow you to spoof or disguise your phone number to make it look like someone else is calling. Another issue, online defamation, or efforts to damage someone's reputation, is a form of harassment that can have devastating consequences. This can happen either through the perpetrator posing as the victim, like making a fake social media account in their likeness and posting humiliating content, or by simply spreading harmful information through digital networks. Non-consensual location tracking via physical trackers like AirTags is also a major problem, as well as digital tracking through apps. So the most common compromises we see to victims' safety in terms of tracking their location, in my practice experience, are through social media, smart car apps, and Find My iPhone. Image-based sexual abuse is another form of TFA. This includes sextortion, which is the distribution or threat to distribute non-consensual intimate images. And this can include posting those images publicly or sending them to victims' personal contacts. In the context of intimate partner violence, sextortion is often referred to as revenge porn and is intended to humiliate the victim or coerce them into staying in the relationship. There's also been a rise in cases you may have seen in the news or in your practice of sextortion scams whereby internet strangers will solicit sexual images from someone, typically under the guise of a romantic relationship, and then extort them financially under threat of publishing the content. Additionally, there's been an explosive rise recently in deepfakes, or AI-generated images and videos, where someone's face or body can be depicted in explicit situations that never occurred. And then finally, fraud and scams are a major issue with different manifestations across the lifespan. So younger to middle-aged adults are often targeted in romance scams where someone poses as a love interest online and ends up requesting money or engaging in sextortion. Older adults also experience romance scams. However, we also see with older adults a lot of financial scams. So due to the slower uptake of tech skills, older adults can be more susceptible to internet fraud through things like phishing scams, where someone poses as their bank or insurance company to obtain personal information, through investment scams on social media, or pop-ups on their computer warning that there's a malware security breach. Some other forms of TFA can include texts or phone calls from scammers who are impersonating someone, like a grandchild, for instance, claiming that they're in an emergency and need financial assistance. So now that we've laid out some common examples of TFA, I just want to briefly circle back to how we see it manifest in different relational contexts. As someone who works in the intimate partner violence and human trafficking space, I want to emphasize that digital technologies are a nearly universal tool being used at this point in these situations. I also want to highlight that we very commonly see manipulation of kids' devices to perpetuate control over victims, even after physical distance or separation has been achieved. So, for example, an ex-spouse turning on location tracking in their kids' phones, their cars, or tablets to help identify a victim's new address or to reveal a secure shelter location. And so the key takeaway to all this to remember is just that tech abuse can take many forms. It's becoming increasingly pervasive, and behavioral health providers across the country are serving clients who have experienced harm in ways that intersect with technology and therefore may require tailored interventions. And so this presentation will hopefully provide you with some general tips on how to approach tech abuse in treatment.
Thank you, Morgan. You did a great job in giving examples across those categories and helping to structure our conversation today and speaking on the intersections with domestic violence. I recall a survey conducted by the National Domestic Violence Hotline, and 100% of respondents noted that technology facilitated abuse was a real part of their own exploitation and harm. So, Adam, I'm going to turn to you because Morgan walked us through how technology facilitated abuse intersects with intimate partner violence. Can you speak a little bit more to what behavioral health providers may see on how this may connect to other forms of harm?
Yeah, definitely. I love this question, so thank you. And I just want to acknowledge first that based on my work in the field, behavioral healthcare providers might think that they need to be tech experts to work with individuals who might be experiencing tech facilitated abuse, but that's rarely the case. In fact, as Morgan has mentioned, tech facilitated abuse or TFA can intersect with many other forms of harm and experiences of abuse, and therefore you may be already serving clients who are actually experiencing TFA right now. And it's important to remember that TFA often uses the same forms of power and control found in the Duluth power and control wheel, such as things like abuse, intimidation, blame and minimization, economic control, coercion and threats, using children, and isolation. And these intersections of TFA occur with sexual violence, stalking, domestic violence, and human trafficking. So let's take sexual exploitation scams, for example, which have absolutely gone digital, most commonly with sextortion scams being noted as the fastest rising cybercrime, according to the FBI. And artificial intelligence or AI is being manipulated and used in human trafficking scenarios by empowering online impersonators to groom and manipulate victims by creating the ability to modify and amplify their photos, their videos, their voices, and even their personalities. So, in a situation where someone's being tracked without their consent or stalked, criminals can also use AI to violate their privacy. For example, AI is really good now at guessing the location of where a photo was taken. Or someone can use something called a facial recognition search engine to learn things about a victim that the victim wouldn't want others to know. In intimate partner violence situations, a common form of abuse is non-consensual account access. And while in many circumstances it can be absolutely healthy to share accounts and devices and apps with a partner, we all do it. In abusive situations where the sharing is in fact non-consensual, this puts victims in an extremely unsafe position. Because an abusive partner can monitor their communications, their locations, their finances, while also controlling and manipulating the information they contain. So, a good example of this is a person's Google account. Because accessing a victim's Google account or their profile will allow the perpetrator to access so many things: their maps, their email, their calendar, their web browser, and more if they're an Android user, for example. This level, I talk about this all the time. This level and volume of detail that a partner, an unsophisticated partner, can access is likely something that a private investigator couldn't ascertain, but every abusive partner has access to it. Similarly, a trafficker could use the same digital access to monitor and control a trafficking victim and keep tabs on them in this way as well. So many of the common forms of tech facilitated abuse we see often involves perpetrators with limited to no technical expertise at all. And that's actually good news because that means we are also more than tech savvy enough to get involved and act. Now, our reliance on accounts, apps, and devices does create a litany of opportunities for bad actors to harm people via their technology. That's without question. But people also rely on technology to survive and thrive. And opting out is just not, is rarely possible, right? We need our technology, which means we need to focus on how to mitigate and reduce tech facilitated harms. We should also recognize how technology can be used to support victims in our work. For example, when we think about AI's ability to guess the location of where a photo was taken, a search engine like this could also be used to locate a person who may be missing. So there are absolutely opportunities here and not just, abusive scenarios.
Thanks, Adam. Jacob, turning to you, what are the common misperceptions that are out there when it comes to how individuals view the impact of technology facilitated abuses versus other forms of abuse? Can you speak a little bit more to that?
Yeah, absolutely. Thank you, Catherine, for the question, and to Adam and Morgan for setting up this discussion today. I appreciate everything you've laid out. As someone who has been a victim of some of the things that we've talked about today, I would love to talk about some of these misconceptions. I want to start by saying oftentimes many survivors of TFA have no idea who their abuser is or was. So a misconception that can come from this is that anonymity helps protect survivors from having as strong of a traumatic response to their abuse. Unfortunately, this is not true. So I just want you to think about the reality of never knowing the identity of your abuser or more likely abusers. It is the case for many who were exploited to create child sexual abuse material, more commonly known as CSAM, that there's more than one unknown abuser because many other people may have received and shared content of survivors. This was the case for me in my own experience of abuse. And while I can understand it may be incredibly difficult to know your abuser or to still have them in your life, there are a unique set of challenges that come from having no idea who abused you and having no control to prevent others from continuing to abuse you through interacting with your CSAM. It can be hard to assign blame, to not see everyone as a threat, to not fixate on trying to find your abuser in the vast web of the internet, which is, as we've talked about, impossible or oftentimes impossible. And most of all, to not ever have the opportunity to look your abuser in the face and say your piece. In my personal experience of technology facilitated abuse, the person I was video chatting and messaging with turned out to be a pre-recorded video of a young girl who was my age at the time. I was 14. And she may have herself been a victim of technology facilitated abuse. When I expressed that I wished to stop speaking to this person, the conversational tone switched. I never saw another human on the other side of the camera again. And the abuser started to blackmail me to create CSAM. Many people are catfished in this way into creating child sexual abuse material, which means they are lured into a false sense of security because they believe they are talking to somebody who they can trust. For some, that trust is exploited. They never actually know that they are talking to somebody who is trying to exploit them, and that trust is continued to be built with that person, and they are continued to be exploited for CSAM. And then for others like myself, when that trust is broken, and you find out you've been lied to the entire time, you are in a knowing relationship with an abuser who is still continuing to exploit you for child sexual abuse material. This creates a lot of confusion, as it did for me. The confusion of going from having a perceived consensual relationship with somebody my own age to so quickly realizing I was being abused by an unknown adult was a huge hurdle for me to get over when I sought therapy as an adult. This is unfortunately a unique but common experience for survivors of technology facilitated abuse. I believe that while the scenarios of abuse can differ greatly between victims of TFA and contact abuse, the emotional impacts are more similar than different, especially as people continue to see less difference between their online and offline lives. TFA feels just as real as anything that might happen offline.
Thank you, Jacob, for sharing your perspectives here. Kate, based on what Jacob shared, what guidance do you have for the behavioral health providers on this call on what supportive services should be available when people are reaching out for help?
That's a really great question, Catherine. Thank you so much. And I'm so honored to be here to be a part of this conversation. When we consider those impacts, it's really critical that we reflect on the diverse forms of TFA that were shared by my fellow panelists and the countless ways in which these forms of abuse can impact the lives of individuals, their families, and even our communities. Frequently at Sanaa, we've seen a misunderstood form of TFA is synthetically created sexual abuse material, which we often refer to as deep fakes. We frequently have a misconception in society that this type of sexual violence is not as harmful because the sexual violence depicted is, again, incorrectly perceived as not to have physically occurred since there was not direct physical contact with the victim. But it's really important to understand that this form of violence has an immense impact on the psychological, relational, and even economic well-being of survivors. The generation of this synthetically created content, it's meant to humiliate, it's meant to shame, and it's meant to degrade those that it's depicting. Essentially, it's meant to dehumanize the individual. And I'm sure, as we can all imagine, this has a tremendous psychological impact on survivors. Synthetically created sexual abuse material is frequently also shared widely, impacting many areas of an individual's life, including their employment and educational roles. This widespread impact starts to feel like an individual can't escape from the abuse. And like Jacob shared, it makes it difficult not to fixate on finding your abuser or even tracking the cases of where the content of you has been shared. In addition, like both Morgan and Adam shared, just like all forms of interpersonal violence, TFA rarely occurs in just one form. Often we see survivors of all forms of TFA experiencing both synthetically generated abuse material or those that were, real content that was shared, experiencing other forms of technology-enabled abuse. This can include things like doxing, which is the sharing of our personal information, like our email correspondence or our phone number, and it often escalates to sharing extensive personal information, things like our home addresses through online forums, social media, and other platforms. I'm sure, as we can all imagine, this creates very real physical safety concerns that transcend beyond the abuse that's happening behind a screen. For example, a perpetrator might share their victim's personal address publicly with an open invitation to cause harm to them at their home. I've worked with clients where their personal address was shared by the perpetrator who is posing as the client themselves and stating that they're seeking sexual encounters at their home. This has resulted in men arriving at their front door and believing that they'll be engaging in consensual sex acts with the victim. I share this to show that TFA is intersectional and spans so many different forms of interpersonal violence perpetration that are important for us as behavioral health providers and social service providers to be prepared for and to know the kinds of support our clients might need. In addition, outside of the misconceptions about psychological and physical harm, there are often misconceptions on behalf of us as service providers, as Adam shared, that we are not equipped to support survivors of TFA or that we might need to be tech experts. And I can assure you that is not the case. But it is important for us to remember that forms of violence that we're familiar with as service providers are things that we already have in our wheelhouse and our expertise. So these are not new forms of violence. They're simply the violence perpetration method that's changing through technology. So as service providers, we have so much experience that we can draw from in other fields that will allow us to support survivors in a trauma-conscious and person-centered manner, even if we're not familiar with all of the evolving forms of technology. Essentially, TFA is grounded in the same forms of violence in which many of us know very well, like human trafficking, domestic violence, dating violence, sexual violence, and stalking. There are, however, some new considerations in safety planning, legal frameworks, and even how we might deliver the services that we do need to be mindful. But many of us have the competencies already, and with a little support, we can really effectively support survivors. In addition, as Jacob shared, there's also a lot of misconceptions on who perpetrators are, and even assumptions that if we don't know these perpetrators personally, that the abuse is somehow less traumatic. It's important to remember that what we have seen is that while technology-facilitated violence might not involve physical contact, it has immense physical, social, and psychological consequences. And we see the devastating impacts whether the content is synthetically produced or there were real images and content. We also see the same psychological and relational impacts when a perpetrator is someone we know personally or when there's someone we don't know at all. What we want to remember as service providers and mental health professionals is that we need to lean in, we need to listen well, we need to build trust and strive to create a safer space where clients can share their experiences and their unique impacts of the abuse. At Sinai, we're working on a protocol that can help us in the social service provider spaces to navigate the evolving complexities of TFA so that we can familiarize ourselves with the different forms, screen for it, and build in tools to support survivors, as this form of violence is not going away, but rather we're just going to see it increase. Unfortunately, in the absence of this, many survivors are left without access to critical support, and many clients we serve report feeling more alone when they're met with providers who don't understand the realities and scope of what they're experiencing.
Thank you, Kate. So, Jacob, based on Kate's response to your perspectives, I'm going to bring it back to you of staying within this clinical service discussion of what are the potential psychological, behavioral, short and long-term impacts of technology-facilitated abuse.
Yeah, absolutely. I'd be happy to talk about this. And thank you, Kate, so much for all the work that you're doing and outlining some of it here. I would say for me, there has been a through line in the short and long-term impact from my experience of technology-facilitated abuse. Again, because I had no idea who abused me, and because I also had no idea who to turn to after my abuse ended. There was nobody talking at the time. Again, I was 14, so that would be about 15 years ago, just for some context. There was hardly anybody talking at the time about how common this type of abuse actually was, and unfortunately, how common this type of abuse still is. I felt I had to shoulder the entire healing burden myself. Although I had supportive parents and friends, I felt the sexual nature of what I had done would lead me to either getting in trouble or being bullied, and frankly, I held at the time the learned belief that a man should be able to deal with it. My method of choice at 14 for dealing with these feelings was unfortunately to shove them down, project confidence, and just trying to project as if nothing was wrong with me at all. Unfortunately, I learned from the, I will say, quote, success of doing this to repeat the method for many difficult situations I found myself in later in life. For the first few years in my teens, I was almost proud of myself, I guess, for being able to shoulder such a burden. If I ever talked about my abuse, I would never let a weak emotion show because the last thing I wanted was for people to think I needed help. Not because I was afraid of emotions, I love and loved to be there for others during crisis, but because experience had taught me that men shouldn't put their crises on others. The years of projecting confidence took a toll and had lasting consequences. Throughout my 20s, I have possessed a deep inability to ask for help, to speak up for my own needs. I was unable to identify when I was unsafe in other instances that have happened to me in the past 15 years, and to properly take care of my general mental health on a daily basis. Unfortunately, or fortunately, it took the wake-up call of federal agents knocking on my door about a year ago and telling me that my CSAM, my child sexual abuse material, was still being circulated on the internet for me to wake up and start to deal with some of these issues. For some context, I am 29 and just starting to deal with the impacts of my abuse. The sad thing that we all know is that there are many male victims of abuse that wait till much later than 29 to start healing. Of course, we want to prevent abuse, but I also believe that there is an almost equal need to prevent men from learning that they must carry their experiences alone. I would argue that loneliness is the greatest impact of technology facilitated abuse and the greatest danger to survivors. At retreats and in support groups that I have been a part of, I have seen this problem firsthand. There were men in their 60s and 70s who experienced abuse before they were 10 and are still struggling to trust. These men said the thing that plagued them more than their abuse at this point was their loneliness, both in that they felt like they didn't have a strong community of fellow survivors to talk to, and that the shame and hurt they carried from their abuse had caused them to retreat inwards for decades and assign blame to themselves. If we do not talk about the frequency of TFA and normalize broaching these conversations with both children and adults, people will continue thinking that their abuse was their fault, continuing to feel lonely. Of course, as we know, it's not our faults, and survivors shouldn't have to carry the shame themselves. Thank you.
Thank you, Jacob. And as an example today, to help normalize what some of these experiences are, particularly for men and boys who may not reach out for help in at the rates that they may need to. So then, Kate, kind of bringing it back to you in terms of some of the misperceptions that are out there. Um, Jacob was just sharing of how the lack of normalizing it means people aren't spotting it. And within a clinical setting, how do you think the misperceptions or the lack of understanding tech facilitated abuse is impacting misdiagnosis or misinterpretation or missing what this is within a clinical or other behavioral health setting?
Absolutely, Catherine. Thank you so much. And this is one of the areas I'm most passionate about talking about in this work. And thank you, Jacob, for sharing that really powerful statement about shame. It encapsulates so much of what I know about this work. In our work at CNR with clients and communities impacted by TFA, we've seen significant cognitive, emotional, behavioral, and physical impacts that you can see here on the slide. We'll get into each one of these. This is, of course, not an exhaustive list, but it does give us a place to start exploring. When we think about the cognitive impacts, we have clients that frequently report symptoms, including things like difficulty concentrating, because they're constantly scanning for threats of where the abuse material might have been shared. We also see high levels of rumination of things that have happened that were outside of their sphere of control. And sometimes we see an elevated sense of self-blame for what happened, especially in the initial stages of healing. We also see intrusive thoughts about the abuse that occur throughout the day for clients, which makes daily living really, really challenging. And as Jacob shared, we also see a deep sense of mistrust for others because of the violations that survivors have experienced. What we also want to highlight that's really important are client experiences with dissociations, which is a common symptom across traumatic violence. And it's something that we see is particularly elevated for TFA survivors. Then when we think about emotional abuse, such as shame, fear, anger, and this could be at ourselves, at the world, at society at large, or at the perpetrators themselves, we see a sense of hopelessness and powerlessness that's frequently reported by clients in the aftermath or when it's actually happening in the moment. These emotional responses often carry a strong level of intensity in how they're being felt, and the duration is frequently very long, which makes it difficult to manage without support. These emotional responses are really, really common for traumatic events, and oftentimes they're consistent with diagnoses of anxiety and depression. Now let's look a little bit at the behavioral responses to TFA. So now we frequently have clients reporting an increase in engaging in hypervigilant behavior. So things like constantly checking outlets for where non-consensual images or content might have been shared. This can be all-encompassing for someone's life, because it feels like this is one area where maybe they can regain some sense of that sphere of control that's happening to them. But often, unfortunately, we see that content sharing is so far outside of anyone's sphere of control that the checking and the hypervigilant behavior can amplify some of that trauma exposure and increase some of the cognitive and emotional impacts that we just shared. And lastly, like with any traumatic experience, we also see physical impacts and somatic symptoms that occur through things like sleep disturbances, body tension, or even clients that feel like they're totally disconnected from their physical body. These trauma responses, of course, look so different for each of us. So as service providers, we really want to make sure what we're doing is creating space so that clients feel safe to explore their symptoms and that we can really look at symptom management in a way that's meaningful for each person. The other thing that's really important to note when thinking about survivors of TFA is the increase in suicidal ideation, attempts, and suicide completion. In our work, we've seen a significant degree of suicidal ideation and survivors of TFA dying from suicide. This really underscores the need for us as service providers to conduct ongoing assessments and ensure that our support is consistent throughout the duration of services. Overall, what we want to remember about TFA is it escalates very quickly. It reaches all aspects of our clients' lives, sometimes in a matter of hours or even minutes. And at present, it often lacks a legal framework to support survivors in things that feel meaningful. As Jacob shared, TFA survivors often report a great degree of isolation, loneliness, and feeling that they have to carry this all on their own. These feelings of hopelessness and feelings that the client has no ability to change the outcomes or stop their perpetrator is incredibly devastating. I'm sure we can all imagine that this would result in high levels of distress for any human experiencing this and those trauma responses and shifts in the way that the client sees the world and moves through their days. These elevated levels of trauma responses are often misunderstood and misdiagnosed by service providers or behavioral health practitioners when they don't understand the very real and wide-reaching impact of TFA on our clients' lives. That's why it's so critical for us in the behavioral health fields to understand TFA and the impacts on our clients and the communities that we serve, and contextualize behaviors and symptoms using a trauma-conscious lens. Let me try to make this a little bit more concrete, since sometimes this can feel a little bit conceptual. So let's say I'm working with a client who's experienced image-based sexual abuse. When I meet with them, they share that most of their day is spent combing through content to see where their images have been shared, and even contacting websites to have them removed, which is a very, very common situation that I see in working with clients. They also tell me maybe that they report it to law enforcement, and the response is that there isn't anything actionable that they can investigate at this moment, which is often a very common experience, as law enforcement might not always be equipped, or our laws have not progressed at the state or federal level to provide meaningful avenues for investigations. What happens then with many of the clients that I've worked with is I see them combing through thousands of pages of non-consensually shared content and other forms of bullying and abuse, and cataloging them in hope that gathering this evidence will lead to an investigation or someone will intervene. Unfortunately, this is not a fast process, and survivors often have limited legal pathways to report the content. This takes a tremendous toll on mental health and well-being of individuals, not just clients, but providers as well. So as service providers, what we can remember that we can do to support survivors in this process is help individuals to create safer boundaries for themselves when engaging with this traumatic content, and connect clients to resources for image removal and other kinds of tangible supportive resources. We want to remember that trauma-conscious care begins with providing the client autonomy to determine which services they feel is best for them and whether or not they wish to make a report to law enforcement. As providers, we can also explain what the process of making a report looks like, connect our clients with an advocate or peer support specialist who can help them protect their rights, maybe interrupt harm, or reduce systemic re-traumatization. We can also provide our clients with language for them to request an officer who has specialized training in TFA, responding to other forms of trauma, things like sexual assault, trafficking, or domestic violence. Like all forms of violence, as service providers and as mental health professionals, we must first address the environmental realities and support individuals in increasing physical and psychological safety before we focus on symptom reduction. So when we think of this practically, this means we want to assess physical, psychological, and environmental safety and work on creating at least safer spaces for our clients. One way this can look is by starting to increase physical and environmental safety through content removal, exploring reporting avenues that feel empowering, and connecting with those concrete resources that we discussed. Another way this can look is increasing psychological safety by supporting clients and setting temporal boundaries on how much time they're combing through content, and also building in self-soothing tools that feel accessible wherever that client is in their journey.
Thank you, Kate. So far we've kind of have a framework on what this can look like in a variety of different ways. And then you've helped to ground collectively, the experts here have helped to ground us in what this looks like in lived experience in different clinical settings. So I'm hoping by this point, if you're a behavioral health provider on this call, you're like raising your hand saying, what can I do to do more, put this in practice? And so kind of Kate, going back to the clinical piece for a moment, at what point in the therapeutic process are you recommending that providers, or should providers consider prioritizing assessing tech-facilitated abuse? And how can they do that without compromising trust or re-traumatizing their client?
That is such an important question, Katherine. Thank you so much. At Senar, we really believe that TFA assessments should start at the time that we're doing any other assessments as a start of service provision. So that for us means during intake. And when concerns arise, so if someone comes into session and something has changed for a client, we want to continue that assessment process for TFA. I do want to be clear, though, that beginning the assessment for TFA during the intake process does not mean that we're doing a deep dive into someone's traumatic history immediately, but rather that we're assessing for safety risks that are associated with TFA and using active listening to understand our clients and what they need to feel safe. Or if active abuse is occurring, we want to be able to screen for that quickly. As we know, as service providers and as mental health professionals, building trust starts by asking clients about their preferences way before they walk in the door to receive services. For example, as service providers, we can ask our clients, if they feel safe talking on the phone, if they feel safe using email, or even asking them if camera on video calls feel safe and accessible. This is a gentle part of pre-screening that opens the door to discussing technology-facilitated abuse. At SINAR, in our Project Lighthouse program, we are also in the process of developing an assessment for TFA to support service providers in screening. The goal is that we can be able to do this either as a standalone screening or we can fold it into the broader assessments that we're doing for other forms of interpersonal violence. Like any form of violence, as we've all discussed, as each of us and panelists have said, there's so many parallels. We also know that clients need to understand the why of the questions that we're asking and be provided with choice and autonomy. As service providers, an excellent place for us to build in the context for the why of our questions is during the informed consent process. Here, we can be transparent and share why we're asking these questions, how the information might be used, and any limits to confidentiality. This also allows clients to have autonomy in what information they may choose to share and have an understanding of how those responses might be connected to broader implications for services. We can also share information about the types of resources we can offer and are available to them. At SINAR, we always center the principle that the assessment should serve a purpose and a benefit to the clients, and the answers to our questions should always be optional, integrate choice and autonomy, and follow a pace that feels best for each individual client.
Thank you, Kate. Now turning it back to Morgan, let's say that in a clinical setting, a client may not necessarily disclose or even recognize the experience of tech-facilitated abuse. Are there any particular questions or strategies that could be used? What could this look like in practice?
Yeah, so I mean, as with other forms of abuse, clients may not recognize that what they are experiencing is harmful, or they may just be resistant to people labeling it as abuse. And this can be particularly true for situations of tech abuse because, as we've kind of been talking about, these experiences are unfortunately often minimized by society, and survivors may wrongly feel a sense of self-blame for engaging in certain behaviors like, sharing a password with an ex or sending money or intimate images to a stranger. And as Jacob has described, it can also be difficult to characterize abusive situations for clients who don't know the perpetrator's identity. And so it's important as providers to just listen and mirror whatever language the person uses to describe their experiences. So again, like with other forms of violence, they may use more casual language like, it felt like a red flag the way he started demanding that I share my location after our first date. Or I had to quit my job because my coworker was so annoying, spamming me with calls and messages. So as providers, rather than jumping to label situations as abusive or traumatic, it can be helpful to simply reflect what we've heard and probe further with open-ended questions. And as Adam has referenced, and some of the other panelists, more often than not, TFA is not highly technical. So in my research and field experience, the most commonly abused technologies that we see are phones, email, and social media. Vulnerabilities that can often be addressed collaboratively through the client-provider relationship. However, even in more difficult situations where outside technical support referrals may be necessary, the first step to getting clients that help is asking about it. So if you take anything away from me today, please let it be that you should not be afraid to ask about potential tech abuse just because you don't think that you'll personally be able to solve it. And then circling back, kind of building on what Kate introduced a second ago about assessment, beyond the initial intake, some additional opportunities to talk about tech abuse could be when clients talk about major life transitions, like entering a new relationship or exiting out of one, or if they share that their living arrangements are changing, like they're moving out of the family home or they're getting a new roommate. And the reason is that these types of transition points can create added vulnerabilities as people may be integrating or separating their tech ecosystems with other people. So as an example, if I was hearing about a client's brand new relationship, along the way, I might ask some questions like, tell me about how your communication is going so far. How do they contact you throughout the day? Do you typically share your location with each other, or have they asked to see where you are at certain times? If you're discussing any plans like moving in together, how are you thinking about sharing access to your home security system or combining utility and financial accounts? Basic questions like that. Um, and as you're thinking about integrating this type of assessment in your practice, I want to again emphasize something that's come up a couple of times already, but I think it's really, really central to this discussion today, which is that most behavioral health providers already possess all of the important baseline skills necessary to assess for tech abuse because we are trained in recognizing and talking to clients about trauma, violence, and abuse. So when I go out and work with community-based violence advocates, I always emphasize that tech abuse is not a brand new type of abuse. Rather, it is a tool, a new tool and evolving that provides a highly effective way for perpetrators to cause the emotional, sexual, and psychological harm that we are already well trained in addressing.
Kate, anything you may want to add to what Morgan shared?
Sure. I mean, as Morgan shared, we might really start by asking specific questions about how our clients feel when they're using technology and when they feel empowered versus when they've had safety violations. So, for example, let's say we're working with an individual exiting a trafficking situation. This is a great opportunity to explore with the client if they've ever felt like there was information their trafficker knew, but they didn't know how they had access to, like maybe where they were at a certain time of day, for example. Here, you can start to explore what devices their trafficker had access to, if there were any consensual or non-consensual intimate images or content taken. And this is a great way that you can also start to introduce and assess for tech safety.
Okay, and then so we've talked a little bit about the in the clinical setting, but we also want to bring up the importance of prevention and other opportunities for intervention. So Morgan, turning it to you within a research context or other practice, what does this sound like in practice uh, to integrate prevention and other forms of intervention?
Yeah, I think it's a great question. A universal education approach can help promote primary prevention, but it can also serve as a strategy to provide information, resources, and increase safety for those who may not feel ready to seek help or disclose their experiences of tech abuse. And given that tech abuse is constantly evolving and we know that it can happen at any point across the lifespan, it really is important to provide basic education on tech safety and risks for all clients who walk through the door. Depending on your setting, it may be useful to develop some informational posters, some brochures, or safety cards that provide some, tech abuse 101, so to speak. Things like green flag information on healthy tech use and relationships versus red flag behaviors to look out for. It could be things like information on emerging trends and ways that tech is being used to cause harm, as well as general cybersecurity tips. So actually on the slide that just pulled up are some universal safety tips that I try to educate all of our clients on, as well as the advocates who we work with, as a way to reduce risk of tech facilitated abuse. So Avoiding account compromise through proper password management and the use of two-factor authentication are crucial, particularly for accounts like iCloud, the Google Suite, email, and banking, which, as Adam was talking about earlier, can really provide wide-reaching opportunities for control when those get compromised. Clients hopefully should always be mindful and vigilant about what information is available about them online, like through social media, and who has access to location tracking in your apps or your phones. And as part of that, it's important to educate clients that reviewing their location tracking settings needs to be a regular practice and not a one-time thing. So for example, there was a recent update to Instagram and Snapchat's terms of service, which automatically turned on a lot of users' location sharing in the app. And I had several clients in domestic violence shelters whose location was compromised because of this change, and they didn't realize that until we were in a session looking at their settings again. I always encourage clients to remove any unidentified apps on their phone that they don't remember downloading due to the risk of spyware. And when possible, it's good to avoid providing personal information to companies who may end up selling it to sites like White Pages or People Finder that allow you to buy people's personal information. I also try to encourage clients to be thoughtful about who they share account privileges with, because I've seen a great deal of abuse happen and be very difficult to address because perpetrators had administrative privileges to things like victims' phones, their car apps, or their home security systems. And unfortunately, that often means that companies will refuse to help remove abusers from those accounts unless the courts get involved. And then finally, setting boundaries with friends and family about what they are or are not comfortable with being shared about their personal life online.
Thank you, Morgan. So we're going to shift the conversation for the providers on the call as they're considering evaluating or adapting any therapeutic services that they may be offering. Kate, going back to you, what do you think are the most important things for providers to be aware of when they're considering treatment approaches to address the impacts of tech-facilitated abuse?
Absolutely, Catherine. So with, any form of active violence, we want to remember that treatment approaches are highly dependent on the state of safety that the client is in at the time of treatment. What we find to be the most important part of this process is obviously starting with our trust and rapport building. And it's important to remember that this takes time, and that as service providers, we really need to earn that trust through consistency of our actions. So to do this, we can take time to actively listen to what's important to our clients and to create that safe container before we dive into any traumatic event processing. At Sonar, we use what we call a triphasic healing model to assess the appropriateness of different forms of treatments for clients. In the first phase, which we call our grounding phase, we might be working with someone who is currently experiencing TFA or has recently exited a situation where they experienced TFA, or maybe someone who's just still really feeling outside of their window of tolerance in their nervous system, so meaning they're not feeling regulated right now. In this phase, in addition to the trust building and rapport, we start to secure those external concrete resources that we've discussed, but we also really start to expand internal resources and tools that increase psychological safety. And we often use sensory-based and somatic approaches to do this at the beginning of our work. So research that we frequently use at Sonar is called the cool down kit, where a client builds a soothing portable self-care kit with sensory items that can help to regulate the nervous system. It essentially uses the 5 senses to quickly foster self-soothing, psychological safety, and increase emotional regulation. For example, it could include essential oils for the sense of smell, maybe a picture of the beach for a sense of sight, a stress ball for the sense of touch, maybe a mint or a tea for taste, and then 2 stones that you could rub together for sound. These are portable and practical tools that we build with clients all the time, and we also use them for ourselves. They're traveling, something that's really practical, and they can be made with everyday items.
Thanks, Kate. So then, Jacob, as a follow-up to that, are there any particular best practices to empower survivors to begin regaining their autonomy, healing, and rebuilding a sense of control after experiencing technology-facilitated abuse?
Yeah, absolutely. And I also just want to quickly thank Kate and Morgan for outlining so many great practices inside work with mental health professionals that can help survivors like myself. I want to talk about something a teeny bit different or outside of maybe the one-on-one space of talk therapy. Because for myself, and I found that the most important and lacking tool for survivors of technology facilitated abuse is community. The moments I have spoken with other survivors have been the most impactful to my healing journey. Knowing that you're not alone, having other survivors to look up to, and being able to speak freely and candidly with others to understand firsthand what you went through seems like a cliche example of a healing practice. But for survivors of TFA, it is rare that we ever have these basic experiences. This is because there are very few survivors willing to talk about their experiences, despite the huge number of growing victims. Talk therapy is an incredible first step. I have been in talk therapy for 10 years, but from my experience, it can lead to the confusing feeling of being able to be fully yourself in session and then having to mask with the rest of your community for the majority of your daily life. Where are the more public spaces, right, where people can feel safe and secure to speak out about their abuse to, others in the community? I know firsthand speaking in these spaces that they are largely unavailable, but that they're also being asked for in greater numbers all the time. Part of what I'm doing in my work is to help to create a framework for collaborations between survivors like me and mental health professionals to build support groups for victims of TFA. It's my hope that one day we will be able to have a nationwide network of survivors connected by local support groups. I am an example of someone who is healing that can now hopefully help to heal others. And I just imagine the good we can all do for both children and other adults at risk or who are currently experiencing TFA. If we have a plethora of survival role models and community leaders, I believe achieving this starts with creating a community for adult survivors that you all as mental health professionals are interacting with on a daily basis. Thank you.
Thank you, Jacob, and for your leadership currently in building such a community. Kate, turning to you, are there evidence-based practices or trauma-informed practices that you found to be helpful and effective in your work supporting people who've experienced tech-facilitated abuse?
Yes, absolutely. So once a client is in a situation where they are physically safe and they've built emotional regulation and self-soothing tools, at Sonar, we frequently then move into the second phase of our triphasic healing model, where we begin to explore trauma processing with a client through evidence-based modalities. At Sonar, we call this our healing phase. So some of the evidence-based modalities that we're currently using are things like eye movement desensitization and reprocessing, or EMDR, internal family systems, accelerated resolution therapy, somatic experiencing, or even narrative therapy. Some of the considerations here depend on the clinical presentation of dissociation symptoms that a client had that really need to be assessed for modalities like EMDR to ensure that they're appropriate for a client. This phase should always be guided by the client with lots of choice and autonomy, like we talked about, so that they can select modalities that feel most aligned for them. Outside of these more traditional psychotherapy modalities, we've also found that expressive arts and music therapy, animal-assisted therapy, trauma-sensitive yoga, and other sensory-based modalities are really effective with survivors of TFA. Recently, I started integrating equine-assisted psychotherapy into sessions, and the outcome has been truly life-changing. I have frequently found that forms of animal-assisted therapy can be really powerful in rebuilding a sense of connection, closeness, and boundaries and trust in the aftermath of TFA with many of the clients that I've had the honor to serve. Regardless of the modality that we're using as clinicians, we want to be mindful in the way in which we're utilizing technology to deliver these approaches. So this may mean assessing whether telehealth sessions are appropriate or if in-person feels really critical because of a client's history. These are discussions that should be had with the client and determinations that are made based on client preferences, their perception of safety, and their pace preferences. Outside of technology and service delivery, it's also critical for us as providers to remember that given the nature of TFA, it's rarely over. And what I mean by that is content resurfaces, stalking can escalate over time, it waxes and wanes, and safety is something that we need to assess in an ongoing manner. As a part of this, we want to be intentional in reassessing safety in each meeting and session. And this can be as simple as inviting a client to share if anything has occurred that made them feel unsafe since we saw them the last time. We also want to remember that we're fostering a relationship that normalizes discussing physical, psychological, and emotional safety. So, for example, we may be in a session and we notice a client is actively dissociating in that meeting. And for those of us that might not be as familiar with the term dissociation, this is the moment where we're disconnected from our bodies in the present moment. We may see a client who has sort of that 60,000-foot stare that someone is here with us physically, but mentally they're completely somewhere else. And this is a great indicator that we need to move into the first stage of the healing process and really build those grounding tools. So when we're thinking about evidence-based modalities, we want to start addressing that client in that present moment. So if we notice that dissociation, we acknowledge it, we normalize it as a trauma response, and we ask how the client is feeling in that moment while providing some grounding options that are often somatic or sensory based. So I may say something to my client like, listen, sometimes when we're feeling disconnected from the moment, it can be really helpful to use our five senses to come back into the here and now. And one of the fastest ways we know how to do that is through our sense of smell. And maybe you want to try some of these essential oils and see if any of them feel supportive to you. And then we can make you a kit to take home for you. And whenever you're feeling disconnected, you can do this breathing exercise. This is just a gentle way to start with some psychoeducation around trauma responses, build practical tools, and send client home with a sort of tangible self-soothing resource that they can use whenever they need it.
Thank you, Kate. So I know this webinar is really focused on the target population of behavioral health providers. However, I also recognize that many people who signed up may not be practicing in clinical settings. They may be friends, caregivers, family members, social workers, other professional, or in any setting to support someone that may be experiencing this, or to support a community or population. So I kind of want to go into a part of our discussion where this is applicable to a broader population, inclusive of behavioral health providers. But Morgan, turning to you, earlier you were talking about digital safety planning. Can you share a little bit more about what digital safety planning is and what this can look like in practice?
Yeah, absolutely. As with any other type of abuse, safety planning for tech-related harm, it must be highly individualized, it should be person-centered, and it should be created through a collaborative process with the clients that we're working with. Again, as with other types of safety planning, there is no one-size-fits-all solution for staying safe with tech. Particularly because we all have very unique tech ecosystems and unique needs for our devices. We need them for different purposes. So the overall purpose of digital safety planning should be to help clients minimize or eliminate harm while still maintaining access to the tech that they need for connection, employment, and safety.
Great. And Adam, coming to you, there's a wealth of resources that I know you can share with us of, again, more practical tools on what this can look like.
Yeah, definitely. Safety planning is so critical to our work, and it can take so many forms. But one area that we can highlight is the ways to recognize and avoid romance, financial, and extortion scams online, as they all really tend to carry very similar red flags and hallmarks. And so let's, for example, take a sextortion scam, which will always culminate in the scammer seeking an intimate photo from the victim. And usually they're doing this in a really accelerated timeline. They're moving very quickly. So if we inform people with education about how these scams actually work, they'll be better able to recognize a scam when it's happening and approach these interactions with healthy skepticism. It's important to share that with any new technology, it's always easier to be tricked and to think, that you're actually not being catfished because you don't realize how far the technology has come. And this is where highlighting modern scam techniques can really help people avoid these sort of new or AI facilitated scam tactics. So, for example, if someone wants to determine whether they're being catfished, um, historically, they might call or video chat with the person, thinking that will help them determine whether the person is catfishing them or not. But now, of course, we know that there are face swapping apps that scammers can use to video catfish their victims. And what we want to do is provide resources and information that isn't overwhelming and that will help people feel like they have greater control and are in the driver's seat. So, by educating people about these new and emerging tools and apps that scammers are using, we can talk through these additional strategies that can mitigate the possibility of being tricked or catfished. So, in this example with video catfishing, we can suggest that not only does a person, if they're going to choose to video chat with someone, when they do this, we might also encourage them to ask the person they're video chatting with to engage in movement or hand gestures. So that could look like standing up, shaking their head back and forth, moving their hands in front of their face. So you know I'm not doing this to you right now, because if I were, you would start to see these live deep fake or live face swapping or live catfishing scammers glitch out. It'll show digital artifacts. And many behavioral care providers are already engaging in safety planning with their clients in other contexts. So this makes it essential to extend this support to clients in mitigating safety concerns in their online lives as well. It can be really simple. It can be as straightforward as ensuring they've updated their passwords and double checking to make sure no one's logged into any of their apps or accounts. That alone can do so much for a victim's privacy and physical safety. Now, there are additional resources out there where we can learn more about tech-forward safety planning in the context of online safety. So Spark, the Stalking Prevention and Awareness Resource Center, is one, or the National Network to End Domestic Violence Safety Net Project are both really amazing resources for anybody wanting to learn more about tech-forward safety planning.
Morgan, anything you'd like to add to what Adam offered?
Yeah, just building on that to maybe offer a concrete example that we can talk through. I want to say that when engaging in safety planning, it's crucial to assess risk, to educate your client, and specifically to safety plan for potential escalation once digital connections are severed. So, for example, we tell all of our clients that if they find an air tag that's been tracking them, don't destroy it immediately, to drive to, the parking lot of a grocery store that they don't shop at, or drive to a police station parking lot before destroying it, because it will show the other person the tag's final location, and that could compromise their safety. It's also important to come up with a plan for immediate documentation of abuse and plan for safe storage of evidence if survivors at any point choose to participate with law enforcement, particularly given that so many platforms now are being designed to allow for altering or disappearing messages or content. On this slide, I've provided an outline of how we on our team start to safety plan for tech abuse in the context of coercive control, like someone trying to escape an abusive relationship or a trafficking situation. So we start by mapping out their tech ecosystem. So gaining an understanding of what devices does the client own and use, who purchased and set up each device, and if they have a car, asking about any car apps or smart features that are connected to the vehicle. We then also map out all of the digital accounts that the client uses for various things, like their social media platforms, if they do banking online, what shopping or exercise apps they may use. And as we're asking about each of these accounts, we're assessing who has access to those, either through shared passwords or previously logged in devices, and who has administrative privileges on each account. And then finally, if there are children involved in the situation, this is also when we would map out the children's devices and accounts, who has access to them, and understand when and how children may be physically moving between homes or locations. And so, as an applied example of what this could look like in practice, let's imagine a client who has been attempting to exit a trafficking situation, but the perpetrator somehow continues to find where they are and seems to always know who they're talking to. So, to initiate digital safety planning with this client, I might say, you've told me that this person has used technology to control your movements, your money, your communication for several months. If you're ready to exit the relationship or situation, it may be useful to map out all of the ways that you are still connected to this person through technology in case that's how they're monitoring you. And so when assessing a client's tech ecosystem, I find it useful to draw a physical map that the client can use to visualize how each of their devices and accounts are connected and to identify those potential vulnerabilities. So let's say that this client reports having an iPhone that's owned by the trafficker, an Android, and a laptop, which are their personal devices. I would want to know, I would then ask about what digital accounts the client uses and take notes on who has password or device access to each. If clients are open to it, I actually encourage them to take out their phones in the session so that we can review all their apps and accounts in real time. Because most people, myself included, underestimate the number of accounts that they have. And it can be particularly hard for clients to recall all of that when they're in the midst of trauma. And so as I'm taking notes on all of their accounts, you can see here, I always put asterisks next to any apps that have location tracking capabilities to flag this for clients. I then ask clients to draw arrows indicating which accounts are connected to which devices. And you can see in this example how there are a mix of accounts that are owned by the trafficker. The trafficker knows the password for several of the client's personal accounts, and that accounts are logged into different combinations of devices that are either only owned by the client versus those that the trafficker has control over. And you can see how this exercise can quickly become really overwhelming as clients realize how interconnected their digital worlds are with someone who's causing them harm. So based on this information provided, I would point out to the client that some of the most obvious points of potential vulnerability are the iPhone and the associated iCloud account, which are controlled by the trafficker, as well as the other accounts that have both location sharing and messaging capabilities, so Snapchat and WhatsApp. And all of these are potential answers as to how the trafficker knows the client's location and how they're aware of private conversations that the client is having from their devices. So from here, I would, ask the client about any safety strategies that they have already tried with these accounts, like changing the password, adding two-factor authentication, logging out of other devices, and then go through each device and account to review security settings as the client was willing. And if there are security questions that I don't personally know how to address, I don't hesitate to model for the client how to search for this information on Google and provide guidance on sources that are more likely to be trustworthy than others. So, for example, if I'm needing help learning how to secure a client's iCloud account, I show them how to first look for help on Apple's website, as opposed to other websites like, Reddit that may have less reliable or just out of date information. So I hope that was a helpful exercise to walk through. And with that, I'll turn it back over to Director Chon.
All right, that was a lot of great framing, the theoretical framing, the clinical practice tips, the very practical resources that currently exist, the resources that are in development that Jacob was talking about, the networks and community. And at this point, I want to thank all of you for being here today and for leaning into this conversation. Your role in identifying risk, validating experiences, and supporting recovery is so essential every single day. A special thank you to all our panelists, the experts, for your time, your insights, your leadership, for helping us to be better at our respective jobs. And hopefully this is just the start of all our inquiries on how we can be stronger in supporting survivors and their loved ones who've been through technology-facilitated abuse. And just to summarize, what we heard today is that technology-facilitated abuse is real, it's growing, and it's affecting people in deeply personal ways. That means we must keep sharpening our own awareness, strengthening our responses, and expanding prevention efforts in addition to clinical services, and we have to do it together. We hope today you're leaving with a deeper understanding of what technology-facilitated abuse can look like, how it impacts the people we serve, and how your practice can continue to evolve to meet these challenges with compassion, insight, and innovation. Thank you again for your time and your dedication and the work that you do every single day. I will turn it back over to Samantha.
Thank you, Director Chon. And thank you again to everyone for your attendance today. I want to try to catch you before you sign off. We've got just some data to collect, to think about what you learned today, what we can be doing next, and we'll share our contact information if you need anything further. So thank you again for attending this webinar.